Hi guys, I'm Jalen Kunkel and I'm going to be walking you through a total hip arthroplasty today. There's 3 different types of approaches for this surgery: the anterior, posterior, and lateral approach. Today we're going to be talking about the posterior approach. So some advantages to this type of approach are that the hip abductors are not disrupted, so they're still intact throughout the whole entire procedure. Also, the surgeon gets a really good look at the hip joint with this type of approach. Some disadvantages include increased risk for dislocation of the hip, and hip precautions interfere with function of the hip. So this surgery includes disrupting the tensor fascia lata, the TFL, which is in the posterior hip region, and the gluteus maximus fibers are split to detach the short external rotators of the hip. So all those muscles are going to be affected. You're going to present weakness in all of those post-surgery. So this is kind of a look at what goes into the hip. This is your knee joint. This is the acetabular component, which is inserted into the pelvis. This is the femoral head, which fits nicely in there. The femoral stem actually goes into the femur, so that's what this line shows. Some hip precautions include no flexion past 90 degrees, no hip adduction past neutral, and no internal rotation past neutral. And then a combination of all those 3 are what can dislocate the hip. So post-surgery. So some activities that would that you really have to be careful of post-surgery are putting pants on, getting in and out of a car, getting in and out of a bathtub, feeding your pets, bending down to pick up a bowl for your pet that is flexing your hip past 90. So those are things you really have to rethink and figure out good ways to approach. Today we're going to practice getting in and out of bed. So someone without a total hip replacement may get into bed like this. And out of bed like this. So with that, I flexed my hip past 90 degrees, I internally rotated my hip, and then I also adducted my leg to get out of bed. So all of those are factors that could dislocate your hip after surgery. So someone with a total hip replacement, say it's my left leg that I got replaced, you want to sit on the edge of the bed, you want to scoot back as far as you can. Some people may be tempted to use their non-surgical leg to help the surgical one up onto bed, but with that you really need to be careful because you could internally rotate and adduct your surgical leg. So you can use your non-affected leg to help get up on the bed like this. You want to lean back and pivot so that your leg gets onto bed and you don't go past the 90 degrees. So here you want to make sure there's enough space in between the middle of your legs so you're not crossing over. Some people put pillows in between, and that could help too. So to get up, you lean back. You want to make sure you don't go past that 90 degrees. Kind of lift up and pivot. And you use your non-surgical leg to help get up.